Myself, Dr. Occupational Therapist from Pinnacle Blooms Network, Suchitra Facility.
Hello everyone, I am Durga Bhavani from Pinnacle Blooms Facility. I am behavior therapist.
So, today we are gonna talk about this main part of our daily living is the activity of daily living. What is ADL and what are the components of ADL and what are the scores for ADL to identify whether they are good or enough or they need some more assistance or they are not able to identify kind of things. There are some scales to identify activity of daily living scorings. So I'm gonna explain you what about all these things. Now let me now tell you what is activity of daily living. The things which we are doing every day to live our life. It is not like doing something something like cheating, chatting. It is not like that. The activity in the sense it's all about eating, your self-care, sphincter control, transparency, locomotion, communications, all these things. So even though communications, transference, all this comes under the activity of daily living. So what is the importance to note about the activity of daily living? If the question is like that, it is very much important because to live our life independently, we have to know all our skills to live every day. So the skills require self-care, sphincter control, transfers, locomotion, communications. Now I will be explaining all these things. So what comes under the self-care? The self-care talk about the eating, grooming, bathing, dressing upper body, dressing lower body, and also the toileting skill. Yes, these all the skills will be calculated in the form of using FIM scale. It is functional independence measure, which is an upper scale which is used widely to calculate the score of activity of daily living. By calculating, we can identify whether the patient or the case or the person is independent or modified independent or supervision needed to the patient or more assistance needed or complete assistance is needed. So, can you have any doubt in this?
Not for now, I'll ask later. I have few questions. I will ask.
Okay. So let me complete everything as soon as possible. Now I told you about the self-care. In the self-care, how we can calculate, ma'am, whether it is independence or modified independence. As I said before, there is a score called FIM score. It talks about the independency level. The highest score will be the independency is 7. It starts from 0 till 7. So the modified will be from 5 and also the assistance needed will be from 4 and complete dependency is 0 to 3. It will be talking about dependency and independency. So to identify whether the person is independent in the eating, if we want to talk, we have to check it with a scale where if the person is okay to eat himself without any guidance, without any assistance, it is all about he is independent in eating. If the same person couldn't able to eat without spoon, in the sense he is using some kind of device or something to finish his eating, but still he can eat by himself. So we call him as modified independence as he is using some devices. And where it is comes like supervision needed. The person can eat by themselves with a spoon, but without supervision they cannot because they may have some fear factors or fall or they may not have proper coordination, they may spill out the food. So these and all things will come under the supervision. So where we call the modified dependency. And the dependency comes completely where the person cannot eat food by themselves but still they can chew and swallow. Even the eating doesn't speak only about the action of eating, it speaks also the swallowing moments. So when the person even can't able to chew the food, he can't able to swallow, when the person is under tracheostomy conditions. So we call them as completely dependent. So these are the variations only in the eating depending on the Finch score. So next we talk about the dressing. So when it is coming to dressing, there is the upper body dressing and the lower body dressing. Same like from 7 to 0, it is depending on if the person can do them themselves or with some device use, or with some device use with some supervision, or else completely they need help, or they can't even wake up to dress up. It falls on the complete dependency. And the next one is the grooming. Grooming speaks about cleaning their face by themselves, cutting their nail, combing their hair, and being aware of their dressings. All this comes under grooming. So if the person can able to feel that they are not well dressed, they are not good looking, in the form of if they are affected with any kind of disease or anything, they can be come under modified supervision is needed. So if the person can able to do combing, but if he can't able to comb back of his hair and all, that time the person comes under the modified independency, because the person can able to do by himself. So as he couldn't do completely, it falls on modified independency. If the person can able to do completely all his things by all his own without anyone's help, then he is automatically called as independent in grooming. So and the next one is the toileting. Toileting is all about talking the feel, the maturation reflex, and the sense that they are getting, and the way how many times they go to pee or poop. All these things if calculated on the toileting. If the person can able to go to the washroom and he can able to wash himself and he can clean up himself, so they fall under independence. If they need some any assistance, they are called as modified. Same like as I said before, everything will be same. So next is about the Spencer control. So what is the Spencer control? Spencer control is the function happening in our body all about the bladder and the bowel and bladder movement. So as I said before, toileting, it covers only about the cleaning, if the person can do or not, if the person can go and comes alone or not. But here, if the Spencer control is completely talking about the reflexes, as I said before, the reflex, if they are having the control on their pain, or if there is no control, or it is like how many times they pee, all these things comes under the Spencer control. If there is no control in their Spencer things, again the person falls on the dependency, and they should able to know that they are getting pain, or else they should be able to wear their pampers or whatever it is required to take care of them nicely. So all these things should be covered in the Spencer control. This is also scoring from 0 to 7. And then the transference. So transference is the thing where the body, the person can move from one place to another place. How does they go? So what are the places we talk here is like from the bed to chair, chair to bed, and whether they can go from sitting to standing, all these things. And then from like a toilet. See, we have the different form of sitting in the toilet. Some of them are in the western, some of them are in the Indian style. So whether the person can able to sit and stand, they can take the squat position or not. All these things are calculated in the transfers. And also the shower. Most of them will be having normal shower. Some of them will be having tubs. And then the floorings, all out, everything is noted. Whether the person is able to bath in the nice without slippery floor, or if there is a slippery also, the person can able to balance their body. All these things are spoken in the transfers, because where there is a mobility, there should be the balance as well. So if the person is affected with a balance issue, obviously they will be affecting their ADL, the activity of daily living. And the second thing is locomotion. As same as the transfers, Locomotion is also another form where the person uses the walking instruments, like they can use the wheelchair, and when the person is climbing on the stairs or slide, is that okay? Walking on the normal floor is different, and walking on the stairs and the slide is completely different. So whether the person is able to do all these things, this is also scored, as I said before, from 0 to 7, speaking about the film scale. What is about the communication? So activity in the daily living, all about, we said that eating, grooming, walking, bathing, and also spinster controls, everything. But why comes the communication in the ADL? It's a very very important question, and the question to be asked, why? The thing is, communication is not only about talking, it is all about the expressions the person is giving, and also the comprehension which they are forming. So the way of expression and the way of comprehension, it is also having the score in the film from 0 to 7. If the person is able to give proper expression for the proper emotion, and they can talk properly, means it is like the 7 is the score. If the person can able to give reply, but they can't be able to give emotions, they won't give any expressions, just they will give the news, just they communicate, means they will fall supervision or under modified independence, because they can able to speak, they can able to convey the message what they want to tell. When the purpose couldn't able to talk, just they will speak 1 or 2 words to express, they will be classified as modified assistance is needed, where the score will be 4 or 5. And then if the person can't able to talk, but they can able to give expression, means also the assistance needed will be the category. And if the person can't able to do both, and just they will look after us and they will be quiet, means the score will be 2 to 3. And when the person is not even ready to reply and ready to listen, or not even giving an eye contact, all these things, that will be called as 0 score. The person is completely dependent to communicate or express something. So this is what all about the film scale and the activity of daily livings which we do, and the total score for the film will be 126. As we know, it is from 0 to 7 for all the components. We will be calculating according to the scorings. So there is an 18 components in the film scale, and the total score is 126. If the person is pursuing 90, it is called modified independence is needed. If they are pursuing 110 or 115, it is also independency with some help, with some assistance. If the person is getting 126 out of 126, then the person is completely independent, they can do their work on their own. And mainly, even if the person is completely independent with the use of any devices, at any cost, the person is called as modified independence. So this is all about the film scores and the explanation of ADLs. So if you have any doubts in this, you can ask me, Durga.
Thank you, ma'am. I have one doubt. How ADLs are related with safety measures in kids as well as adults?
Nice. As I said before, if the person is on modified independence, everything will be with some assistance. Unless until the person is independent, it is not going to affect in any way their safety. If the person is in modified independence, they will be using kind of devices or any kind of assistance to overcome their needs. That time, if for example, if the person is using a walker or a wheelchair to locomote, to go from one place to another, if there is no any proper way, if the person doesn't know about how to move, how to come and go, again he won't go, he just stops moving from one place to another. Even though if he is independent, modified independent to do his work by his own, if there is no proper situation and proper way for it, and if he doesn't have the proper knowledge to use the wheelchair, he will be coming again under dependency. He will be seeking some other people. So there is a huge relation with the safety and the activity of daily living. If there is no proper education about the things they are using or the way to use, there will be problem. As you asked about the kids, till now I am explaining all the things about the ADL for adults, you may guess. But how we can relate with the kids? As same. What about the eating? Whether the kid will come and communicate that they are hungry or not, or else the kid can communicate that they can be able to pee, whether they are getting challenging or not, whether they pee by themselves. All these things we will be scoring same as the scores 0 to 7. By these skills we can be use this to the kids. And one more thing, when we are using this scale to the kids, there is another thing which is age appropriate. We cannot put the kids scoring as they are modified independence, they are dependent, all these things, because the kid is in the developing stage. They will be perceiving all the developments slowly by age. That duration we cannot justify kid like he is dependent or he need a modified dependency, all these things. We can be giving the results like age appropriate, whether it is there or not. And mainly when the kid is here, we should concentrate the transfers in the kids. Transference in the sense, if unless until the kid is having 15 months, there is no expectation. There should not be the expectation for walking fast, all these things, because usually till 15 months kids will be taking some time to walk properly. So until that we have to wait. So after the age of 15 months, we can put our kid in small area test, like just ask the kids to walk on the slippery floor and the soft floor and harder on the mud, all these things, so that slowly we can identify and we can work with whether they are lagging or not. But most of the time kids won't lag in their ADL. We have to teach them in proper way, which we do beautifully in our therapy times. So the kids are also able to learn. The main thing is we have to teach kids in understandable way. It is not about how we wear the dress and how we remove our clothes. It is they have some other techniques. So we have to look into that how it is, and we should not put stress on the kids to learn all the ADL as well.
Okay, ma'am. I have one doubt. Like you said, adults will also be affected with ADLs. So, can normal adult who is functioning very well will be affected with any kind of ADL activities?
Yeah, obviously. ADLs will be affected not only with any kind of issue or diagnosed with any kind of disease or not. Even if the psychological health is affected, obviously the person's ADL will be affected, because if they are falling into any kind of depression or stress, obviously the person will avoid eating, they avoid grooming, they avoid all these self-care things. When self-care is affected, other things will be gradually decreasing. The way they used before will be decreasing. So obviously the ADL will be affected. So being a behavior therapist, we have a doubt. See, why there is what are the ways you can motivate the person falls under stress to improve their ADL?
Okay, so if a person who is stressed or who is having any kind of psychological issue, first of all, we'll clarify what their issue is, and then we'll see what ADLs they are affected, and then we either we will work with their family as well as we will talk with them. First we will clear what their stress is, how they are affected. First, we will solve the issue. What is the main reason they are having stress with? That is the only one way where we can help them with, like if a person is having stress, depression, why they are depressed, why they are being stressed, why they are having anxieties. We will work on that area so that their ADLs which were affected, they can work for functionally and well properly with their ADLs. So once the problems are reduced, like this ADL, the stress, depressions, once they are reduced, the person will automatically automatically get motivated to do their ADLs.
Yeah, it was a nice explanation, man. So, any questions if you want to ask through this webinar, you can ask. We will be waiting for 5 minutes. In meanwhile, I am coming with I want to clarify some things when it is coming to the kids. Some of the kids will be having stubbornness. For that reason, they won't do any kind of brushing, eating, all these things. So obviously, we cannot judge kid as like he is not doing eating, he is not grooming, he is not dressing, he is not bathing. So whether the kid is independent or not. So we have to find the root cause for the thing why the kid is not eating, not taking self-care. When there is a stubbornness, obviously the kids would not, they don't like to do any kind of things. So what we can do to rectify this is, we should not encourage their negligence towards their ADLs. ADLs is a thing which we can teach any kind of patient, even though if the person is bedridden, they will be having kind of ADL techniques to look into their work themselves. That is what all about occupational therapy treatment to make a person independent. So, same in the kids, we can apply in the playful way. When it is coming to adult, we can do it in the little more processing, like rules, not about the rules, something protocol where the person should able to feel free to do themselves. Because even to get the score 120, it is not that everyone should get 126 score. Even the normal human being will be having the score from 120 to 126. It's all because the score will be lagging in the communication area, because not all the human being will be talking with the expression with the proper comprehension. They will be talking something, depends upon their mood. If they are happy, they will be talking nicely with a smiling face, the nice thing. If they are depressed, even though the happy news will be coming with a dull face. So it is not judgeable that you are getting 126. It is not, you are not an independent person. Even though from 120 to 126, we can have the difference in the score to be perfectly independent.
Okay, ma'am. I have one small question about the firm scale. Will that be easily accessible, like parents, for parents and the people who wants to test for ADLs? Will that be easily accessible, or where they can go for testing it?
Yeah, it is. It's not about easily or hard to access. It can be it will be diagnosed by the occupational therapist, the physical therapist, and also physician sometimes. So mainly the occupational therapist will be playing a role on the ADLs to make the person independent. If in case the person's family member or the person itself to know about his score, he should be clear about the film scale. So he can get the knowledge through the concerned therapist, or in case he can search in some books, not in the Googles, because so many factors are there in the film, and also there is a new form of film. So people, please don't get confused with any kind of Google searches. If you have any concerns, you can directly contact us to know about more in ADL. So thank you for giving the opportunity to talk about ADL in this webinar. Here I am Dr. Reema Maurya, occupational therapist from Pinnacle Blooms Network, Suchitra facility.
And I'm Durga from behavior therapy from Pinnacle Bloom facility.